So today I have a great guest for you. You'd absolutely love her. She loves life. And she's a specialist for kids. And I'm just going to have her introduce yourself. Her name is Dr. Karen. So, Dr. Karen, can you please introduce yourself to our audience?
Sure. Good evening, everyone. My name is Dr. Karen. I am a board certified pediatric dentist. I have been a dentist now for almost 20 years. I'm only 27, but don't worry about the math. And it is really a joy and a pleasure to be with my colleague, Dr. Valerie, today. Thank you for having me.
Oh, thank you for saying yes. I'm so thrilled. So I've always admired you. I look at your Facebook. We have a group of lady dentists, and Dr. Karan is part of that group. Is a sister in dentistry, and I've just noticed her. I've just noticed how she loves. She calls them her yum yums. She loves her little kids, and she has the special gifts that they bring to her. And so, yes, I wanted to ask you, Doc, like what caused you to want to become a dentist and to be specific, to become a pedodontist, a specialist just for kids?
Well, many years ago, I happened to meet an amazing general dentist, Dr. Cummins, and I spent an entire summer in her office interning, and that is when I first fell in love with dentistry. Fast forward a couple of years when I entered dental school at Columbia University in New York City. During my clinical rotations, I noticed that the kids naturally gravitated towards me and the feelings were mutual, and I just loved the kids. My area of concentration was actually pediatric dentistry, and that's when I knew that pediatric dentistry was for me.
Okay. And so, for somebody who's curious, how long did it take you beyond becoming a general dentist to become a pedodontist?
Well, to become a pediatric dentist, it takes an additional 2 years after dental school. And then I became board certified directly after that. And then I became a fellow of the American Academy of Pediatric Dentistry. So I did the whole schmooly, the whole thing.
Wonderful. I commend you for that. I commend you
Thank you.
for that. I can assure you guys that Dr. Karen, like her kids love her. They do love her. She has all sorts of pictures on her social media of kids just hugging her, like bringing her like all these drawings and all that. And yeah, you can tell that the feeling is mutual. So she's definitely speaking from her heart.
Truly.
So doctor, we are basically this week, kids started going back to school. And so, what are ways that parents can actually get their children to be ready, with healthy mouths and ready to learn?
So it's such an interesting question. For me, it starts with early visits to the dentist. We want to make sure that the children develop a trusting, healthy relationship with their dentist. And that should start as soon as the first tooth comes in and hopefully no later than the first birthday. That first visit is primarily for educating the parents on proper oral hygiene habits, nutritional counseling, the types of foods that we would ideally like the child to eat. We talk about transference of bacteria. A lot of parents don't know about vertical transmission of bacteria from the primary caregiver to the child, accident prevention, what to do if the child loses a tooth. There's so much information that is given at that first visit. It is not only about the child sitting on the chair and getting the clinical exam. That first visit is primarily for the parent. Now, I don't know if you know Dr. V, I'm sure that you do, but the number one reason that children miss school is, drumroll, it is because of tooth decay and dental pain.
Yes.
So if we can be proactive and try to do whatever we can to make sure that the little yum yums are having a great day in school and they don't have to go down to the school nurse and say, oh, I have a toothache, and now you have to call the pediatric dentist. Let's try to see to the best of our ability what we can do to get those kids in early, to teach them the habits that they're going to have with them for a lifetime. And there's simple things that we can try to do.
Mm-hmm.
For instance, let's look at the snacks that we are packing with their lunches.
Mm-hmm.
Let me start by saying that every parent is doing the best that they can with the resources that they have.
Right.
So what I'm about to say always comes from a place of love and understanding.
Right.
There's no judgment involved.
Right.
So what I like to tell my parents, do the best you can with what you have.
Mm-hmm.
And sometimes it's about substitution.
Mm-hmm.
Maybe instead of packing the donut, which is sticky and has a lot of fermentable carbs,
Right.
maybe you can do a banana with a couple of Hershey's Kisses, right?
Mm-hmm.
Because we don't want the child to feel that they're being denied, but we
Right.
can make this, right?
Yes.
Instead of the fruit roll-up, give them a piece of chocolate. Chocolate melts.
Mm-hmm.
The fruit roll-up is not going to melt, and it's going to stay on the surface of the tooth.
Right.
So in my office, I love to tell the parents, if it melts, I'm okay with it.
Mm.
But sticky is not my friend.
Gotcha.
So sticky treats are fruit roll-ups,
Mm-hmm.
Rice Krispie treats,
Mm-hmm.
fruit snacks,
Mm-hmm.
pretzels,
Mm-hmm.
right? Goldfish biscuits are a big culprit
Mm.
because these foods are staying on the surface of the tooth,
Right.
and it's more difficult for the child to clear it, and it makes it easier for the bacteria to break down the tooth. However, if the child is having a bowl of ice cream, ice pops, chocolate, carrots, apples, these are all things that are going to clear the surface of the tooth very quickly and less likely lead to tooth decay.
Mm.
There is an amazing book that is written by one of my colleagues, Dr. Roger Lucas, and it's called Eat More Chocolate. I
Really?
want them to eat chocolate. Chocolate is good. It melts,
Yeah.
right?
Yes.
And a lot of parents think about the gummy vitamins.
Mm-hmm.
Parents don't think that gummy vitamins can affect the teeth, right?
Right.
But
Taking its
if you have a gummy
vitamins.
vitamin, it's sticking in the grooves.
Mm-hmm.
So I always like to say the take-home message is sticky is not my friend. If it melts, I'm okay with it. And moderation is key, right? If the
Right.
child has a little fruit snack or a fruit roll-up, the sky is not going to cave in because you're doing the best that you can.
Right. Right.
Now, another thing that I like to discuss with parents is brushing.
Mm-hmm.
We want to start brushing even before the tooth comes in. We want to get into the habit of cleaning the child's mouth, the
Right.
gums,
Right.
the tongue,
Right.
so that when the first tooth comes in,
Mm-hmm.
the child is now accustomed to the parent being in the mouth because the mouth is a very personal and private space.
Right.
So it's about behavior modification.
Mm-hmm.
The earlier you start, you're reinforcing the behavior
Uh-huh.
that the child is now accustomed to you cleaning the gums, so brushing the teeth.
Mm-hmm.
You know, sometimes they're little wiggly worms. And I like to tell the parents, do the best that you can.
Right.
You might not get all of the teeth cleaned at the first time,
Mm-hmm.
but just keep at it and do the best that you can.
Yeah.
And the American Academy of Pediatric Dentistry recommends that we use a smear of fluoride toothpaste for the little ones who are not yet able to spit,
Mm-hmm.
a small pea-sized amount of fluoride toothpaste for the older kids.
Mm-hmm.
For those parents who are not fluoride families,
Right.
there's also the hydroxyapatite toothpaste that we can also use for the kids.
Okay. Hydroxyapatite toothpaste.
Uh-huh.
Okay. That's good news.
I'm telling you. and like water, we want to encourage the kids to drink more water, right?
Yes.
Stay away from the sugary beverages, especially soda and Kool-Aid and Gatorade. And again, an occasional treat is okay, but water is our best friend. It keeps the hydrate.
Yes.
Children are not dehydrated. It's healthy.
Right.
It's
Mm-hmm.
it's
Yes.
readily available. Right? It's readily available.
Yeah.
I love my kids to be well hydrated.
Mm-hmm. So while you were talking about sticky foods, I thought about chips. How about chips?
Not great because they're sticking anything that is going to stay on the tooth for a prolonged time, a long amount of time. We want to try to stay away from. But again, it's moderation.
Right.
And I tell the parents we have to be practical as well, right?
Mm-hmm.
Because it's not always possible for the child to brush while they're in school. But take a swish of water, get the bits and pieces of food off of the surface of the tooth. Even if they pop to the bathroom really quickly and do a quick rinse, something is better than
And
nothing,
nothing.
right? And
Right.
before they go to bed, we want to get into the habit, having our dinner, having our treat, flossing to get all of the food from in between the teeth, right?
Right.
Because the example that I use with parents, I always go like so, right? We're going to pretend that the teeth are close together and we're brushing with the toothbrush. If we're not flossing in between the teeth,
Right.
it's like taking a shower and not washing in between your toes, right? You have to make that effort to make sure that you're also getting the food from in between the teeth, because then those are several surfaces that the child is not able to clean.
Right.
And then we start to see the children having cavities in between the teeth as well,
Yes. I see it
right?
all the time.
Don't know, right?
Yes.
And I always recommend when those big boy molars or big girl molars in the back come in, the permanent 6-year molars, I love to see sealants placed on the permanent molars, because studies have shown that there is an 80% reduction in tooth decay on permanent molars if the children have that protective coat placed over their permanent molars.
80%. That's
80%
significant.
reduction.
Wow.
Yes, and something that's so simple and can take 4 minutes in the office.
Right. Now, do you
hmm
recommend sealants on primary teeth, on baby teeth?
I also, so the way that I approach sealants, we have to look at the anatomy of the teeth, right?
Right.
So if the child is high risk and the molars are very groovy, of course,
Yes.
we always look at the anatomy and the shape of the tooth. I often do sealants on primary molars as well, especially the primary second molars.
I see.
hmm
I see. But then I'm thinking that if you have a child coming from a family where cavities, or they're more prone to caries, you will be more prone to putting sealants on those children as well.
Absolutely. So when I see, I'm glad that you said that, because a lot of times when the parents come in, they might say, "Oh, Dr. Karen, my family has a history of bad teeth."
Yes.
So it's not necessarily that the family has bad teeth, right? It's that vertical transmission of the bacteria
Right.
from kissing. The kids are cute. We're giving them kisses in the face.
Yes.
We're sharing utensils with them.
Yes.
Like take a bite of the chicken nugget,
Yeah.
and then we're transferring our bacteria to them by sharing foods and straws. So that is always a part of the preventive conversation that I have with the parents. We want to try to minimize the vertical transmission from the parents to the child, and also horizontal transmission,
Right.
relatives or primary caregivers.
Right.
So we always want to try not to share straws, cups, knives, and forks, because we want to reduce that transfer of bacteria, right?
Yeah.
And also in families, we also have to look at the social history, right? In
Right.
terms of the foods that we're eating, because some kids live in food desert areas, and food deserts, they might not have ready access to fresh fruits and vegetables. So the parents are doing the
The
best that
best
they
they
can,
can.
and I applaud them for making sure that their kids are fed, but they might not have the same level of access to the healthier and more affordable options, right?
Right.
Because not everyone has a Whole Foods or a Back to Nature around the
Right.
corner
Right.
that they can access, more pricey fruits and vegetables. But do the best you can with what you have.
Wonderful. So, doctor, talk
hmm
to me about flossing. Should babies floss or have their teeth flossed, or is it okay to just not do it? And how early, if they have to floss, should they start doing it?
So here's what I tell parents, especially if they're older siblings in the family.
Yes.
Initially, it's about behavior modification. So when the older siblings are flossing, you want the younger ones to floss, because the younger siblings are going to want to do what the older sibling is doing,
All
right?
right.
I usually recommend let them practice the flossing, even if the teeth are not touching yet. It's more about engaging in the behavior and making it a habit, right?
Yes.
Because once you start engaging in that behavior, When it's really time for serious flossing,
Mm-hmm.
when those back molars are touching
Mm-hmm.
and we can't visualize in between the teeth,
Right.
it is. We don't want to wait until the back molars or the front teeth are touching to start to introduce flossing.
Mm.
We want that behavior to be on board early.
Wonderful.
So even if you're going through the motions of flossing and there really isn't any contact in between the teeth,
Mm-hmm.
you are modeling that behavior for the child. It's all about healthy patterns and behavioral modification.
Mm-hmm.
The earlier we start, the earlier that child is going to engage in that behavior. It's kind of like potty training, right?
Right.
You're training the kid to go to potty. It's
Yes.
the same flossing.
Mm.
We're training the child to eventually become familiar
Mm.
with flossing in between the teeth. But typically we start flossing when it becomes really serious, in quotation marks.
Mm-hmm.
It's between the ages of 3 and 4.
3
Of
4.
course, we have to remind parents that your dental age does not always correspond with your chronological age.
That's right.
So the child might dentally be 3,
Yes.
right? But chronologically before, or vice versa,
Mm-hmm.
right?
Mm-hmm.
So we always have to individualize our treatment to the child at hand. But the earlier, the better.
Right. Okay, doctor. So about toothbrush selection, right? So
Mm-hmm.
you I remember you did say that you'd want to even start brushing or cleaning the child's mouth even before they
Mm-hmm.
have the first teeth. So what do
Mm-hmm.
they use when they don't have teeth? What do they use now when they start having teeth? And also, is using electric toothbrushes better than manual toothbrushes?
Here's what I say when it comes to toothbrushing, and I'm not even joking when I say this. The brush that I prefer initially
Mhm.
is the brush that the child is going to use,
I like that.
right?
I like
Because
that.
some type of brush is better than no brush.
Right.
So let's start at the beginning, right?
Mhm.
I usually recommend a very small head
Yes.
with soft bristles. We should only be using a toothbrush with soft bristles. We should never be using medium or hard brushes.
Mhm.
Oral B, I mean, I'm not sponsored by Oral B or anything. Quick disclaimer. They have the stages toothbrushes for the little babies,
Mhm.
the 0 to 2s, the little toddlers. Very small head. It's key to have a small head on the toothbrush with soft bristles
Mhm.
because we're able to get into the back and those like very hard to reach areas.
Mhm.
If you can't use a toothbrush, there's a little toothette that you put on the finger, and the parents are able to do a quick swipe.
Yes.
There are also wipes that are called spiffies, Spifiies. There's xylitol wipes that we
Okay.
can use to clean the mouth in the babies.
Mm.
As you know, xylitol is a naturally occurring product that inhibits the bacteria that causes tooth decay.
Yes.
So if we're not able to get in there, because remember, I'm realistic, the babies are wiggly worms, right?
They are.
So even if you can get in with a spiffy that's of the xylitol wipe,
Mhm.
I will take what I can get. I tell the parents something is better than
And
nothing.
nothing.
As the kid is getting older, I like my Oral B or Sonicare toothbrushes because they're very effective in removing the plaque.
Hmm.
Mm-hmm.
Wonderful. That's good to know. So let me ask you this then. No, I think you touched to it. You said that you do the best you can. If a parent has a child that is really fighting them, they just have to do the best that they can.
Yes, children are natural pleasers,
Hmm.
right?
Hmm.
And a lot of the times it can be frustrating for parents because the kid is all over the place, they're all wiggly, it can become frustrating.
Right.
But as with everything in life, give yourself credit. You're
Yes.
best that you can, keep trying.
Hmm.
And I say to parents, when you first got the baby and you were changing the diaper, when the baby cried, you didn't stop
You did not.
trying to change the diaper.
Right.
You didn't stop.
Hmm.
So you kind of have to use that same approach with the brushing because if you don't change the diaper, the kid could get a diaper rash, right?
Exactly.
Right? And if you don't brush, the kid could get a boo boo in between the teeth or on the surface.
Right.
So you kind of have to move through it.
Hmm.
Do the best you can and don't give up. And give yourself grace
Hmm.
to know that you tried.
Hmm.
Children are also very smart. So there's something that is called negative reinforcement that I talk to parents about.
Uh-huh.
There's reinforcement, but there's also negative reinforcement, right?
Mm-hmm.
So if the child is crying and we stop engaging in the brushing, we're negatively reinforcing the child, right? So
Right.
now the very smart. We
Right.
have smart. Our babies are very smart, right?
Mm-hmm.
Hmm, mommy or daddy or auntie came to brush. I went, oh,
And they
mommy,
stop.
let me think. So if I engage in this behavior again,
Mm-hmm.
they are going to stop.
Right.
So now we're negatively reinforcing the kid.
Mm-hmm.
So we kind of have to work through it and say to ourselves, we're not hurting our babies. We're kind, loving parents, and we're doing something that is beneficial for them.
Mm-hmm.
And eventually the kids are going to be on board.
Yes.
And every child is not the same. Do not compare your kid to your neighbor's kid, your best friend's kid.
Thank you.
Every child is going to learn and grow at their own
On
pace.
pace. Right.
Have a child who's able to brush at 9 months.
Mm-hmm.
The other child, it might take 18 months.
Mm-hmm.
Third child, it might be 4 years old.
Mm.
Do not compare your babies. Let your child develop and do the things at their own pace.
Right.
Do the best that you can.
I really like that. So
Mm-hmm.
I have so many questions. Doctor,
Please, go ahead.
I see some children sometimes, and when
Mhm.
we brush their teeth, you see bleeding, and sometimes parents are scared. What do you say about that?
Okay, so in my office, we have what I call transformational vocabulary. There's certain words that we do not use in the office.
Mm-hmm.
BLEEDING
One of
would be one of them, bleeding. We call it ketchup, right?
ketchup.
Yes. Times when we have ketchup on the gums that's left over from the chicken nuggets that we had for dinner,
Uh-huh.
it just means that a lot of the times when the parents are brushing, they're getting the coronal part, right? They're getting the tooth,
Yeah.
but they're not getting that part of the tooth that meets the gum lines.
Mm-hmm.
So I like to tell the parents, just angle the brush almost at a 45-degree angle.
Mm-hmm.
But if you have an Oral-B or Sonicare brush, the brush is basically doing the work for you.
Mm-hmm.
And I tell the parents, when you see the ketchup, if you see the ketchup and you get scared and you stop, there's going to be more ketchup. Then you're going to get more scared. There's going to be more ketchup, and then it's a vicious cycle.
Right.
I have to take a deep, calming breath. And I tell the parents, I will give you a sticker. I will give you a toy from the treasure chest. I will buy you a bottle of wine. I'll do whatever you want me to do. Just know that it will get better
Okay.
when you see the ketchup.
Yes.
Just keep going. Close your eyes if you have to, and just do it.
Yes. It's not,
Mhm.
but does it hurt the child when you see the ketchup?
No, the ketchup does not hurt.
Mm-hmm.
As long as we're doing gentle circles with a soft toothbrush, the child is not hurting.
Mm-hmm.
Right?
Mm-hmm.
We have to move ourselves past that psychological barrier that we're hurting the child.
Mm-hmm.
You're doing the best that you can. You're not hurting little Johnny or little Sally. They're fine. Children are very resilient. They're going to be okay.
Thank you so much. That's so encouraging for a parent. So, say for example, you see one of your yum yums and they actually need dental treatment. How can the child be prepared by the parent so that the treatment can be rendered? Because I see a lot of children with anxiety. So,
What I'm about to say might be a little controversial.
uh-huh.
So, in my practice,
Mm-hmm.
I encourage the parents to be my silent partner
Mm.
because I want to build that relationship and rapport with the child.
Yes.
So, let's say little Sally came in and I noticed they had a couple of sugar bucks that required princess sparkles or Spider-Man paint. Remember the
Yeah.
transformation vocabulary. I always take the parents aside and have a separate conversation and I tell them, Mom,
Mm-hmm.
you're amazing.
Yes.
You and I were two smart, good looking women.
Mm-hmm.
We are going to figure this out together.
Mm-hmm.
But in order for me to help your child and be the best possible pediatric dentist that I can be for your child,
Mm-hmm.
I need you to trust me and let me build that relationship and communicate with the child.
Mm-hmm.
What I would prefer for you not to do is to prepare the child.
Mm.
Sometimes when the parents, well intentioned,
Yes.
try to prepare the child, they actually make it worse.
Yes.
Right? now they're going on YouTube and they're telling the kid, oh my God, Dr. Karen's going to give you a shot. It's just going to be a little pinch. It's not going to hurt. I'm going to take you to Target and get you whatever you want. Now the kid's like, wait a minute. Mommy or daddy are promising to take me to Target to get whatever I want. Something has to be going on. And all the child is going to hear is, mommy and daddy said I'm going to get the shot.
Yes.
Right?
Yes.
No, I know. That's not going to work. So I always have a conversation with the child beforehand, and I introduce them to the laughing gas. With the happy nose, they pick their flavor. Because children need to be involved. And they don't like surprises. So I like to show them certain things. I have stuffed animals in the office that have teeth. I have Farley Flossosaurus, Ross the lion, and Ollie the mutt. So sometimes I will demonstrate the procedure on the dummy.
Okay.
So that when they come in, they have some level of preparation. Now, in my office, I do something, I practice kind of outside of the box, right? I'm kind of like an outside of the box type of dentist. So all of my trays are color coded and all of my instruments are face down.
Okay.
So the child never sees any of my instruments when they come into the operatory. And never see my turkey baster. Know what the turkey baster is, right?
What is the turkey base?
The SHOT.
Okay.
So in my office, I have the special lollipop that I only have for brave boys and girls. That's topical anesthetic.
Yes.
And in my office, we have marshmallow flavor. It's a special marshmallow lollipop that I only have for big boys and girls who are good listeners. Right? So they get the marshmallow lollipop first. They never, ever see the NEEDLE. They never get it. And it doesn't hurt because I have already prepared the child to tell them what's going to happen.
Right.
Many times a day, I forget to trim my fingernail. Hint, hint. And feel my fingernail a little bit. Sometimes they don't even feel it because I am very careful about drying the soft tissues first.
Yes.
Let the marshmallow lollipop sit very nicely.
Yes.
And then the wiggle dance with me wiggling the cheek before I enter my turkey baster.
Right.
And before that, I tell the parents, remember, they are going to be my silent partners.
Right.
And they have neutral face, right? Because they are going to see the turkey baster.
Right.
So when they see the turkey baster, it can't be like, oh, no
Exactly.
gasping, sudden movements. We have to be neutral. So a lot of the times when the parents are able to be neutral and supportive,
Yes.
the appointment goes a lot better.
Right.
There are children in my practice who don't even know that they've ever had the NEEDLE or the SHOT. Because the parents are on board, we have the conversations, they don't see anything, we have the laughing gas, we have the TV on, they're zoned out on Bluey or Ricky Nicky Dicky Dawn or Is It Cake? And they don't care what I'm doing because nothing hurts.
Right.
But it takes the parent being able to say, you know what? I trust my pediatric dentist. I am going to let her take over in the operatory and know that she has my child's best interest at heart.
That's right.
And there are times during the visit where, you know, mommies and daddies are doing the best that they can. But we also have to remember that there are a lot of parents who might not have been privy to having a pediatric dentist and they have their own dental fears or anxiety.
Right.
So I am very observant during the restorative visit, and if I see that a parent is becoming a little bit apprehensive, I will say, Mommy, do you remember that you have to give Grandma a call to let her know how amazing Johnny is doing?
Yes.
Would you get out of the operatory for a minute so that you can call Granny and let her know that Johnny is doing like a phenomenal job? And maybe you can go to the treasure chest and start picking out some treats that you think that Johnny would like. So that's my to the parent. I have that discussion with them beforehand.
Right.
I feel that you can't handle this part of the visit. You can stand right outside of the operatories because all of my operatories have little windows in there.
So they can still see their child.
Right. So they can still see the child, but they're right outside of the door if they're not able to manage their own emotions or dental fears that they have.
That's beautiful.
Mhm.
I love that. And so now, Doctor, the last question that I'm going to ask for today, because without any shame, I would love to invite you again for another session
Okay.
one day. I hope you say yes.
Sure.
Wonderful. I wanted to ask you, how do
Uh-huh.
you deal with children who have maybe who are divergent? For example, they may have autism or ADHD. How do you take care of them, and how do you get their parents to treat? I mean, to prepare them for treatment.
I love all of my babies, and I like to say that all of my babies are specially abled.
Yes.
Specially abled.
Yes.
But in my office, what I do, I am more of a behaviorist at heart.
Okay.
My Bachelor of Arts is in psychology. I actually have a Bachelor's of Psychology from NYU.
Wow.
So before I went to dental school, I had the whole psychology thing.
Yes.
So I have what I call desensitizing visits,
Mm-hmm.
where I often have my children who are on the spectrum.
Mm-hmm.
We start small.
Mm-hmm.
They come into the office. I have the parents start by going to my website. They get to see my picture. This
Yeah.
is Dr. Karan.
Oh.
This is what she looks like.
Mm-hmm.
I have them come in, have a tour of the office, and maybe we might sit with Rasta Lion or Farley Flossosaurus, and I brush Farley's teeth, and they brush Farley's teeth. And then every time they engage in the behavior that I like,
Yeah.
they get a special treat.
Right.
So I'll schedule maybe two, three desensitizing visits
Mm-hmm.
where the child is just coming into the practice.
Yes.
They come to the door, we get a little treat. Oh my goodness, you did so great. You sat on the chair. Okay, you got a little treat. I bribe. I have no shame. They let me count the tape. I might be sitting on the floor. They open.
Mm-hmm.
Um, they get another treat.
Yes.
Then might move up to me brushing. They come back. It's just about making the child comfortable.
Mm-hmm.
And a lot of the time, children on the spectrum, they like routine.
They do.
So I literally have them come, let's say, on a Tuesday morning. I
Mm-hmm.
tell the parents, you have to be committed to this.
Mm-hmm.
So I might say for the next couple of Tuesday mornings
Mm-hmm.
at 8:30,
Mm-hmm.
you and Johnny are going to be coming to the office.
Mm-hmm.
It's going to be with the same dentist,
Mm-hmm.
me. I'm the only pediatric dentist. I'm a solo practitioner.
Uh-huh.
It is going to be the same assistant. It might be Leanne or Kayla,
Mm.
and going to be in the same room.
Mm.
So the child knows that when they come to see Dr. Karen, the purple lady, it's going to be at 8:30 on Tuesday in op number 2 with Dr. Karen and Leanne.
Mm.
So I'm gradually building that trust and relationship, and I'm not really changing anything
Right.
without the child's permission and letting them know, okay, today we counted the teeth. When you come back next time, I am going to tickle 5 times with my motorcycle toothbrush.
Mm.
And if I tell the child that I'm going to tickle 5 times, I do not tickle 7 times, I do not tickle 3 times. I tickle 5
5
times.
times.
Because it's about that trust in relationship.
Mm-hmm.
We have to establish trust. And once the child establishes that, A, I'm not hurting them, I am only doing what I told them I'm going to do,
Right.
what I showed them I'm going to do. It's tell, show, do.
Right.
Tell the child what you're going to do, show them what you're going to do,
Mm-hmm.
and
Tell.
only do
Mm-hmm.
what you said you were going to do to build that trust and relationship.
Mm-hmm. Wow.
It requires patience, and I tell the parents, I am going to get Sally to the stage where they are going to sit in the chair.
Mm-hmm.
It will happen.
Yes.
I had to have a child that I was not able to get, and I say it humbly,
Yes.
that I was not able to get to sit in the chair.
Mm.
But I tell the parents, Rome was not built in a day,
It wasn't.
and we're on a long journey together.
Yes.
It just requires 2 things from you: patience
Chance.
and commitment.
Right.
So as long as you're patient and you're committed to the journey, I'm willing to take that journey with you.
Mm.
We're going to have some frustrations, we're going to have some setbacks.
Mm-hmm.
But most of my kids come in, they go right to their room because they have a particular room that they like.
Right.
my two babies, J and J, I can't tell you their names for privacy
Of
reasons,
course.
but since they were like maybe 5 and 7, and the mom cracks up. They come through the door like a gust of wind. They go to Audrey, they sit down, they put their bib on, they get their and we just stay out of it. The mom stays out of it, and we do what we have to do.
Right.
It just requires.
It requires patience.
Mm-hmm.
That's very encouraging. And I really hope that, someone who has children in general, no matter what status they
Mm-hmm.
are, can take heed to this. It's a long journey, and
Yeah.
we are here to take care of them and to take the journey along with them. So this was
Mm-hmm.
very encouraging. In fact, this was even insightful for me as a general dentist because I do see children, and I'm definitely going to adopt a lot of this, what you said. If I say I'm going to do 5 things, I'm not going to
Bye.
sneak a sixth one there. Okay,
No, ma'am.
I get it. Yes. So thank you
Okay.
so much, doctor. This was so insightful. I know that we can never exhaust any subject, but I'm sure that, there was a lot that was thought that was really impactful and, educational for our parents and even, for children. So let me ask you this. If somebody wanted to work with you, how could they find you?
Ooh, how could they find Dr. Karen?
Mm-hmm.
Um, I'm all over Facebook as per my team. I don't really do a lot of the Facebook and Instagram,
Mm-hmm.
but the name of my practice is Howell Pediatric Dentistry. They can send emails to info@howellkidsdentist.com. On Instagram, it's Howell Kids Dentist.
Mm-hmm.
All you have to look for is my purple hair and one of my stuffed animals. The office is purple. Everything is purple. You know I love purple, so
Yes.
not hard to find.
Yes, wonderful. Well, thank you so much for stopping by. Thank you again for saying yes. And thank you, everyone. I think that your life has been optimized today, and we're very happy. And I think that you got a lot of great nuggets as far as getting your children ready for school. And yes, we heard from doctor 80%, I mean, we talked about sealants, the importance of them, but
Right.
we said that one of the major reasons why children miss out of school is because of dental issues, because of dental pain. So let's go ahead and take care of our children so that they can actually be ready to learn. So that being said, we'll see you next time for another episode of Optimize Your Life. Be blessed. Bye.